So many people wonder why doctors miss diabetes, especially early diabetes, so often. It's because the body is working to compensate for the injury. Even the kidneys do this. Watch. This is one of the things that Jesus taught me in terms of diabetic kidney disease. So here's the problem. Quite often people appear to have an appropriate or even a high kidney function, even though they have significant diabetes. So you're going along, you're watching the kidney function, it appears to be normal or even high, and then all of a sudden it starts dropping. And Jesus was pointing out to me that, it's one of the adaptive mechanisms of the body, despite the fact that diabetes is the number one cause of chronic kidney disease. It's got some deception to it. And part of that deception is the body's normal mechanism for trying to accommodate. There are things called AGEs, advanced glycation end products, and they start clogging up the filter membrane. The filter in the kidney is called the glomerulus. So, and by the way, the number one advanced glycation end product is something that we've all heard of. Hemoglobin A1C. It's hemoglobin. So AGEs are proteins that have had sugars bound to the protein covalently, if you're a chemistry geek. For those of you who like to grill, that crust on the outside of the meat when you grill it is to a large extent AGEs, advanced glycation end products. So that doesn't work so well in the kidneys. And again, if you get too much of that, it starts clogging up that filter membrane in the glomerulus. And the filter membrane, which you may remember, is the intima, the lining of the artery wall. So one of the things that happens is the body notices that, look, we're not getting enough filtration through that lining, that filter membrane. So what do you do when you're not getting enough filtration? You increase the pressure. One of the most common cause of high blood pressure is, quote, called idiopathic or essential, end quote, high blood pressure. Well, many of us, if not most of us, believe that quote, idiopathic or essential or no cause known high blood pressure is really from this process, where you're getting hemoglobin A1C and other advanced glycation end products that are clogging the filter membrane, the intima, in the glomerulus or the filter of the kidney. So again, back to this article, this reminder that Jesus was giving us. If you've got diabetes, don't assume that just because your kidney function is normal or even high, that there's no damage going on. Remain alert. Continue to watch all of your other bioindicators. And if you don't know how to do that, that's what we're here for, to help you do that. So that process, by the way, is called glomerular hyperfiltration. In other words, you crank up that pressure to get more fluid going through the kidney. And fluid going through the kidney is what kidney function is all about.